The risk factors of colon cancer and how they contribute to the development of cancer. So, colorectal cancer develops when the DNA in cells of the colon or rectum develop mutations that grow and multiply. According to the American Cancer Society, there are many risk factors that can potentially lead to the development of colon cancer. A risk factor is something that predisposes you to the likelihood of developing a disease, yet some risk factors are modifiable while others are not. Modifiable risk factors are those that you can change. These can include being overweight, being obese, being physically inactive, consuming a diet high in red meats and processed foods, smoking, alcohol use. And then non-modifiable risk factors are those that you cannot change, such as your age, a history of colorectal polyps or colorectal cancer, a history of inflammatory bowel disease, like ulcerative colitis or Crohn's disease, diabetes, your race, your ethnic background, or a family history of colorectal cancer and polyps. Genetics can contribute to the development of cancer because inherited genes and shared environmental factors and certain inherited syndromes such as Lynch syndrome can increase the likelihood of cancer development. The consumption of nitrates in processed foods as well as cooking foods in high temperatures can create certain chemicals that increases the likelihood of developing colon cancer. Smoking can also lead to the development of cancer or colon cancer because it can lead to the ingestion of cancer-causing substances. Chronic inflammation precedes colon tumor development because it causes oxidative changes that damage the DNA cells, and that leads to the formation of mutations. The likelihood of developing cancer increases in those who are obese, diabetic, and sedentary, as insulin resistance, hyperinsulinemia, growth factors, adipocytokines, steroids, and chronic inflammation play a key role in colorectal carcinogenesis.